Very good. Thanks so much for having me. I'm very happy to talk to you about Hello Better today and tell you a bit about what we're doing. In a nutshell, empowering people, changing lives. That's what we're all about. The problem that we're tackling is the fact that there are 1 billion people out there suffering from mental health disorders, and most of them do not receive adequate care. And many of them never reach out for help. Average time from the onset of a mental health disorder till someone reaches out for help is 6 to 8 years. 60% of people are not in touch with the care system, and out of the people that are in touch with the care system, only a fraction is treated by specialists. So what's our solution? Our solution are digital therapeutics, essentially online courses that empower people to change their lives. So we put it into their own hands and help them with the prevention and treatment of mental health disorders. We cover a broad range of conditions, from stress to depression, insomnia, chronic pain, alcohol, panic, and sexual dysfunction in women. All of these can be addressed by cognitive behavioral therapy that's been translated into a digital process. Now, you could say this is sort of almost too good to be true. We have a lot of evidence for this approach. So we have a broad range of products, and we also have a lot of clinical trials that show that these products are indeed effective, and not just somewhat effective. The effect sizes measured in clinical studies and randomized controlled trials are on par with face-to-face therapy. We've conducted over 30 clinical trials on these products, more than any other company in the space, including all of the American players with $100 million of funding. And if you look at this space in the US, there's more than $1 billion that has been invested. It's vastly underfunded in Europe. And that in spite of the fact that we have a massive opportunity here. So we are the market leader in Germany. We've treated some 6,000 clients last year. With the new Digital Care Act, we are going to go from 11 million lives covered currently by our insurance partner to the entire population of 80 million covered, because you go through a process that's similar to FDA approval, but it's not just about market access. It gives you full universal reimbursement. So all health insurance companies are legally mandated to pay for our product. Here are some of the insurance partners that we work with so far. To bring this product into the standard of care, we are working with Ratiopharm. It's a leading OTC brand, a subsidiary of Teva, that is going to put 60 salespeople on reaching out to doctors across Germany to get them to prescribe our solution. That's it. My time's up. Thank you very much. I'm looking forward to hearing from you.
Thank you very much, Anders. Any questions, please?
Hi, I have a question about I know that there is a need there. There's a lot of loneliness, especially in these times. What cycle are you in? Is the product ready? Do you have any pilot clients? So can you explain that to me?
Yeah, there's some 25,000 people that have used our product in the context of research. We've had 10,000 people using our clients in the commercial setup, 6,000 last year. We work with 6 different insurance companies in Germany, and we have 3 clients in Switzerland. And as I said, we are currently going through this process that's kind of like FDA approval that will give us access to universal reimbursement. So any person can get a prescription from a doctor, and health insurance will pay for it.
Sorry, what about the team? Do you have any psychologists on board, or do you have those advisors?
The company was founded by 3 PhD psychologists. David, my co-founder, he's one of the leading researchers in the space globally. He's published 200 peer-reviewed papers and is currently in the process of becoming appointed a professor at Technical University in Munich.
Okay, thanks, Anna.
Good morning, this is Jordan. I'm looking at your profile. It's showing 2.9 million euros in revenue in 2021. Is that right?
No, that was 2020.
2020. And what's the forecast for 2021?
At least 5.
Okay. This is not GMV or this is not transaction volume. This is actual top line revenue.
It's 2 million euros in commercial revenue, actually in 2020, and then there was 900K from grants. Yeah, and then next year it's going to be 5 million from commercial revenue, and yeah, 500K from grants on top.
And geographic expansion in 21 and 22, which countries or which geographies are going to?
So we entered the Swiss market last year, and we plan to expand there. And then when it comes to geographies after that, we are currently in the working with a German accelerator in the US that helps German companies move to the US to evaluate that opportunity. Belgium looks promising because they also have a process to bring products into the standard of care. But yeah, we're evaluating a number of different options right now.
So I'm hearing the US and some other countries.
Yeah.
And that's the German accelerator in Palo Alto?
Sorry?
That's the one in Palo Alto, the German accelerator in Palo Alto?
There are a number of locations. We're working with people out of Boston because that's a life science accelerator.
Got it. Get a hold of us when you have a chance. We'd like to talk to you someone. Good job. Really well done.
Thank you very much.